Hello everybody and welcome back to our channel Anything Under the Sun. For today's video we have something from the health series, and for episode 1 of this health series we have something that is very basic about cancers that all of us should know about. So let us start with a very basic question. What are cancers? So as all of you would know, our bodies are made up of multiple tissues which are basically collections of cells. And these cells can either be normal or abnormal. The normal cells, as shown in the picture here, have a very beautiful shape. They have well-defined margins. They do not grow beyond a particular geography to which they are limited. On the other hand, abnormal cells or cancerous cells, they do not have a particular shape. They do not have these well-defined margins. Rather, their margins are very ill-defined. And as you can also see, they start growing beyond their particular geographical limit. So putting all these together, cancers are conditions in which some of the body cells start growing uncontrollably and also end up spreading beyond their usual geographical limits. So where can these cancers occur? So you must have heard of multiple types of cancers, which means that cancers can start almost anywhere in the body from head to the foot. What are tumors? So this is another terminology that you might have heard from your friends or families or relatives. So tumors are basically an umbrella term under which you have two different types. One is the cancerous or the malignant cells, which we've already seen, which are the more dangerous ones and which need to be addressed and managed immediately. On the other hand, you can also have some non-cancerous or benign tumors. So these are again probably small lumps, small swellings, which means that the cells are still growing, but they do not grow at a very fast pace, and they are typically something that would not spread beyond a particular part of the body. However, some of the benign tumors may also require urgent treatment. But between the two, the cancerous or the malignant tumors are something that are more serious as compared to the benign or the non-cancerous tumors. So this is how a normal part of the body changes from being normal to becoming cancerous. So this normal cell that you can see on the left, it is something that we've already discussed. These cells are very beautiful looking. They have a good shape and structure. They are uniform. They look very similar to each other. The next stage is something called as hyperplasia, wherein you can see there is an increase in the number of cells. Sometimes even the size of the cells keeps increasing. The next stage is something called as dysplasia, wherein you can see some abnormal cells coming in. So you not only have normal cells, but you also end up having a few abnormal cells, which if they keep multiplying over and over again, they result in the final stage of cancer. And in the final stage of cancer, you can see that even the normal geography on top is being invaded by these cancerous stem cells, which means they can start spreading beyond a particular part of the body as well. So who is at risk of developing cancers? Well, we can never really say, because cancers predominantly have a genetic component. This does not mean that all cancers are familial, which we will also cover in a few of the questions that are upcoming. But this only means that your genes are predisposed either by birth or after birth because of some environmental factor or some intrinsic or even an extrinsic factor that puts you at a higher risk of developing cancers than some other people around you. And each type of cancer can have its own risk factors, but in general, you have common risk factors like age, gender, exposure to various agents in the society. So are cancers contagious? Well, in general, no. Definitely you cannot catch a cancer just by being with somebody who already has a cancer. But why do we say in general no? Some of the cancers have an infective etiology as well. There can be viral infections, bacterial infections, or even parasitic infections that are seen as risk factors for developing cancers. And by being very close with people, you can acquire these infections, which ultimately puts you also at a risk of developing cancers. So this is sometimes seen as contagious, but very clearly speaking, cancers in general are not contagious. You cannot spread cancer from one person to another. We've already discussed this. Are all cancers familial in origin? Not always. It's less than 10% of the cancers that actually run in families. Should we screen ourselves for cancer? It is probably really difficult and not very practical to screen all of us for cancers for every type of cancer. However, there are a few cancers like the breast cancer and the cervical cancer in the female population, colorectal cancer and lung cancer, which probably require a good amount of screening at an early stage so that we can identify these cancers and start management at a timely basis. Are cancers curable? Well, this really depends on the type of cancer, the location of the cancer, the staging of cancer. So all these are different parameters that we look at before we can actually say if this particular type of cancer is curable. But the good news is all cancers are treatable or manageable, which means that your lifespan can get extended beyond a particular limit by seeking adequate treatment or management. And today there are multiple modalities of treatment available, which again depends on the type of cancer that we look at. But this includes in general chemotherapy, which can involve a lot of drugs in the form of tablets or injections. Then you have radiation therapy, and apart from this you also have other procedures including surgeries. And it's very, very important that you seek expert advice from a medical or a surgical oncologist for management of cancers. So what are the signs and symptoms basis which we should reach out to these experts? So again, these signs and symptoms can vary widely, but common symptoms like unexplained weight loss, tiredness, loss of appetite, changes at the cancer site. If the cancer is external, then you can probably notice some lump or a swelling or some other discoloration or any other local changes at the site of the cancer itself. However, these are not all the symptoms. These are very few common symptoms that you see across different cancers. So what can we really do to protect ourselves, and can we really protect ourselves from cancers? So the interesting fact is that almost 30% of cancers can be prevented just by following good lifestyle measures and other protective methodologies. So quick look at what can we do to protect ourselves. We can say no to tobacco. If you are a smoker, it's high time that you stop smoking. Limit your alcohol intake on a weekly basis. Adopt a balanced diet plan. This not only protects you from a few types of cancers, but also from other lifestyle disorders like hypertension, diabetes, and obesity. Coming to obesity, if you are obese or overweight, you should start a weight reduction plan and be serious about it as well. Maintain an active lifestyle and also get adequate sleep. These two are probably really difficult in this era with a lot of technological advances coming in. We get hooked to our mobile phones, laptops, but I think it's time that we also try to adopt an active lifestyle and also get adequate sleep. Also, you must have heard of skin cancers. That is something that's not very rare. Try to protect your skin from the sun, particularly if you are very commonly exposed to the sun rays. Then wear protective clothing or some sort of sunscreen. And if you feel you are the right candidate to get screened for the cancers that we already mentioned, or if you feel you are having symptoms of one or the other type of cancer, then it's always a good idea to get yourself screened. So that is it from us for today. The bottom line message is that people have to adopt a better lifestyle because, like we said, almost 30% of the cancers are preventable. And if you are symptomatic, or if you find somebody in your family or in your friend circle who is likely to be symptomatic, then it's always good that he or she consults an expert at the earliest possible, because any delay can be dangerous and is not recommended. So thank you very much. If you did like this video, please do click on like, leave your comment below, also share this to your friends, relatives and others. And if you've not already subscribed to our channel, please do click on the subscribe button and also tap on the bell icon so that you keep receiving updates on our future videos. Thank you very much and stay safe.